Assalamualaikum students. Today we are going to start trace minerals. In our previous lecture we have discussed major minerals. Inshallah today we will discuss trace minerals in which will discuss selenium, copper, zinc, iodine, iron. Phosphorus is a mineral that works with calcium to keep the bones healthy, rigid, blood vessels to keep the blood vessels healthy and muscle working. Phosphorus is work with calcium to keep the bones healthy, rigid, and other role of the phosphorus in acid-base balance, metabolism of the macronutrient, part of the body tissue, keep the blood vessels healthy, muscle movement. If the high level of the phosphorus if the high blood phosphorus level, then it affects the bones, joints, skin. The high level of the blood phosphorus, then patients require the phosphorus binder. It travels through the stomach digestive system and bind the phosphorus before it absorbed in bloodstream. Phosphorus binders must be taken within the meal. Trace minerals that are required in small amount less than 100 mg per day or found in small amount in the body less than 5 grams. Trace minerals are essential for normal development, function, overall health. Iron is needed to build healthy red blood cells. Zinc, copper, iodine is needed for maintaining the normal metabolism. Zinc, copper, selenium protect us from the effect of free radicals. The principal role of iron is to deliver oxygen, body tissue component of hemoglobin, coloring matter of erythrocyte, red blood cell, and hemoglobin allows the red blood cell to combine with the oxygen in the lungs and carry it to body tissues. Iron is also part of myoglobin, a protein compound in muscles that provide oxygen to cell. Iron is absorbed across the cell membrane and erythrocyte produce different iron binding carriers that role in absorption and overall regulation of iron status. One of the example of the iron binding carrier is ferritin. Basically, ferritin is iron binding carrier protein produced in erythrocyte that binds store mucosal iron. When the iron stores are low, then ferritin less amount of the ferritin is made, which allows the greater amount of iron is to enter the mucosal iron pool for transport out of erythrocyte into the bloodstream. and when the iron stores are high or saturated, then the opposite function is take place. How the transferrin is made to transport absorbed iron is oxidized from ferrous to ferrite by a copper containing enzyme, and it bound the protein that called the transferrin. All the cells have a transferrin receptor on their surfaces. So when the level of the iron is low, then increases the number of the transferrin surface receptors, and when the level of the cellular iron is high, then the amount or the number of the transferrin receptors decreases. If there's insufficient diet or low iron intake, malabsorption, insufficient stomach acid, excessive blood loss, or any other issue that causes the depletion in iron store, cause the iron deficiency, or decrease the stores of the iron, prevent the. In Pakistan, iron deficiency is main issue, or the most common nutrient deficiency in Pakistan is iron. If the excessive absorption of the iron, then it is called hemochromatosis, and no specific age limit. The onset of this disorder can happen at any age. If it is not treated, then it affects the liver, spleen, heart, kidneys, and other disease in which iron is overloaded is thalassemia, because of the frequent blood transfusion. Hemoglobin synthesis can be stopped when decrease the stores of iron, and due to this reason, insufficient number of red blood cells to carry the needed oxygen. Symptoms of iron deficiency include weakness, shortness of breath, and clinical sign of iron deficiency includes paler skin and spoon-shaped nail. Iodine, iodine, a component of the thyroid hormone T3, T4, normal function of the thyroid gland, and determines the rate of uh, metabolic metabolism. And if the hyperthyroidism, then it causes the weight loss, and in case of the hypothyroidism, then it causes the weight gain or the difficulty to lose the weight. Iodine absorption is take place in small intestine, and after absorption it is transported to thyroid gland where it is stored. When thyroid gland have insufficient iodine, then function of the T3 T4 is retarded, and they attempt to take more iodine. Due to this reason, the gland is grow. Then gland is grow and forming of lump in the neck that is called goiter. Goiter is also called endemic goiter because it is common in specific areas, and it is more common in female than male.